Good day everyone, I'm Lata from Group 5 and today we will be talking about psychological disorders. Psychological disorders are conditions that affects a person's emotions, behavior and thinking. They can significantly influence relationships, daily functioning and overall personal developments. To better understand and diagnose these conditions, professionals use the DSM-5 which provides standardized criteria to identify and analyze symptoms. However, real-life case studies show us that psychological disorders are often complex and vary from person to person. They can't be simplified or stereotyped as each individual's experiences is unique.
Case Study 1: Michael Jackson Body Dysmorphic. Background and history: criticized by his appearance during childhood by family members, experienced bullying and emotional pressure at a young age. Lived under constant media security and public criticism, grew up in a strict perfectionist environment, faced intense pressure to maintain a public image. Body dysmorphic disorder. Symptoms: underwent multiple cosmetic surgeries over the years, fixated on facial features and skin color, never satisfied with his appearance despite procedures, concern about how others perceived his looks, persistent preoccupation with perceived flaws. Anxiety symptoms: experienced chronic stress and performance pressure, reported difficulty sleeping in insomnia, withdrew socially at times, relied on medication to cope, showed excessive worry about public judgment. Evidence and interpretation (DSM) defines BDD as option with perceived appearance flaws. BDD includes repetitive behaviors like mirror checking or cosmetic procedures. Research links trauma and bullying to higher risk on BDD. Anxiety disorders involve excessive worry, sleep disturbance and tension. Although no official diagnosis was confirmed, psychobiographies suggest his behaviors align with BDD and anxiety criteria.
Okay, let's move on to case study 2. In this case study, we look at Marilyn Monroe, who experienced symptoms linked to depression and borderline personality traits. Her childhood was marked by instability, including time spent in foster care, which may have contributed to long-term emotional difficulties. She struggled with chronic sadness, loneliness, severe insomnia, and dependence on sleeping pills. Despite her fame and success, she experienced low self-esteem, and Marilyn also showed signs such as fear of abandonment, interns, and unstable relationship, identify disturbance, and emotional instability. Her struggles ultimately led her to suicide attempts and fatal overdose in 1962. This case highlights how psychological challenges can persist regardless of external success or public image.
Hi, I am Sabrina. Today I'm going to talk about topic Yaya Kusama, hallucination and anxiety obsessive compulsive symptom. Yaya Kusama is a Japanese visual artist who used her arts to express her inner feeling and mental experience. She was born in 1929 in Matsumoto, Japan. From a young age, Kusama experienced mental health problems, included anxiety, hallucinations, and obsessive. These experiences continued into adulthood and strongly affected how she sees the world. Many of Kusama's experiences can be linked to mental health conditions described in the DSM-5, especially obsessive compulsive disorder (OCD). OCD included obsessive, which are repeated thoughts, and compulsions, which are repeated action done to reduce anxiety. In Kusama's case, her obsessive, which repeated appear in her artwork. Her compulsions can be seen in her repeated use of dot, nets, and mirror. Creating these repetitive arts help Kusama manage stress and give her a sense of control over her fear and hallucination. Her artwork is not just creative experience but also a way for her to cope which her mental health challenging. Kusama's early life also included emotional stress and strict parental control, which may have contributed to her anxiety. While she does not meet the criteria for post-traumatic stress disorder, her behavior shows signs of trauma-related anxiety, such as being high alert, emotional sensitive, and needed to control her surroundings. As an adult, Kusama has shown strong self-awareness and coping skill. She chose to live volunteer in a psychiatric hospital in Tokyo, where she continued to receive treatment while actively creating arts. Although she work is not officially considered art therapy, it works as a personal coping method that help her manage her symptoms. In conclusion, Yaya Kusama life show that having long-term mental health condition does not mean a person cannot adopt or success. With the right support and coping strategy, individual can manage their challenges and live meaningful life.
Hello, today I will be presenting a case study about Herschel Walker and dissociative identity disorder, also known as DID. Herschel Walker is a former American football player who became famous for his successful college career at the University of Georgia and later in the NFL. He was known for his strength, discipline, and athletic achievements. However, what makes his story important in psychology is that he publicly shared that he was diagnosed with dissociative identity disorder. In his autobiography, Breaking Free, My Life with Dissociative Identity Disorder, he explained that despite his success, he privately struggled with different personality states and memory blackouts. According to the Diagnostic and Statistical Manual of Mental Disorders, DID is a disorder characterized by the presence of two or more distinct personality states, along with memory gaps that cannot be explained by normal forgetfulness. Research shows that DID is often linked to severe and repeated childhood trauma. Psychologists like Bessel van der Kolk explain that dissociation develops as a coping mechanism when a child experiences overwhelming stress. Over time, this coping strategy can develop into separate identity states. In Walker's case, he described having different personalities that would take control at certain times. He also reported memory gaps where he could not remember certain actions. These symptoms are constantly with research by Frank Putnam and the theory of structural dissociation proposed by Onno van der Hart. Although DID is a debated, more recent neurobiological research supports that dissociation has real psychological and psychological effects. Walker also shared that therapy helped him gain control and improve his life. Long-term psychotherapy is considered the main treatment for DID, focusing on processing trauma and integrity identity states. Personally, this case changed my perspective on mental illness. It shows that mental health conditions are not always visible, and highly successful individuals may struggle internally. Overall, Herschel Walker's story helps reduce stigma and increases awareness about dissociative identity disorder. Thank you.
Conclusion. Psychological disorders strongly affect how people think, feel, behave, and manage their daily lives. The case studies of celebrities such as Michael Jackson, Marilyn Monroe, Yayoi Kusama, and Herschel Walker show that these disorders can appear very differently in each individual. No two experiences are exactly the same, even if the diagnosis may be similar.